Joe, we've all been taking this news in, incredibly sad for Joe Biden and for the family. It's very serious news when you have prostate cancer, and there's some reports that it's spread to the bones. And I think there's a lot of questions as well.
Again, Zeke, you're an oncologist, obviously incredibly respected. You believe that it is likely, just for those just tuning in, you believe it is likely, if this prostate cancer has spread to the bone, that he could have had it for up to a decade, but certainly it's likely. Would it be fair to say it's likely to have had this for at least several years?
Oh, more than several years. You don't get prostate cancer.
So again, I just want to stop you. So this is not speculation. If you have prostate cancer that is spread to the bone, then he's most certainly, you were saying, had it when he was president of the United States.
Oh yeah. He did not develop it in the last 100, 200 days. He had it while he was president. He probably had it at the start of his presidency in 2021. Yes, that I don't think there's any disagreement about that.
And I'm just curious again, if your doctor to president of the United States that is a male, that is an older man, would a prostate test, and again, we're just talking about a PSA screening, a blood test that you could do along with all the other blood tests. It's not even that it would be intrusive. Would this not be one of the first tests that you would conduct as a White House doctor?
If you're a White House doctor in this situation, I think you would certainly discuss it with the president and talk about the pros and cons. I think if you then ask, well, if President Biden says, well, if I'm your father, which patients often do, what would you recommend? I think the fact is that most White House doctors would recommend getting the test. And again, the evidence is, look at President Obama, President Bush, younger than President Biden, and they both got the test. There was some criticism when President Obama got the test that he got it too young and things. But I think in this case, especially for the president thinking that he's going to live another decade, you would recommend to him to get the test. Now, I want to say there's people, and I'm one of them, that are sort of skeptical of this test and don't really want to have this test. But that is quite common. And I should say, I have had this test mostly to get insurance, interestingly enough. If you apply for insurance, this is one of the tests that they require, just like an HIV test and cholesterol screening tests and other things. So I think your speculation, Joe, well, most White House doctors would recommend this test to the president and would say, I think you should get it, is probably true. Now, the president has the ultimate decision. They just can't take his blood and, not talk to him about it.
Yeah, but certainly, Mika, especially if we're not even talking about living another 10 years. We were talking about the decision to run another 4 years. Certainly, this would be a test that would need to be taken.
Yeah. Zeke, are we operating on, just listening to you and Joe here, trying to figure out what to deduce here, but are we operating on the assumption that President Joe Biden had prostate cancer for at least several years and either did not test for it and then discovered it just now? Is that possible? And would a doctor, a White House doctor and the team, would they agree not to test for that?
Again, if you're a doctor respecting medical ethics, you talk about it with the patient. Do they want this test or not? You talk about the pros and cons. You talk about what the recommendations are of various organizations, including the American Urological Association, the American Cancer Society. So the ultimate decision is President Biden's. I would say that it is surprising he did not get this test, given the fact that the proclivity of presidential physicians is test more rather than less. And I think it's a little strange. We do know from the population, like I said, 7% of people diagnosed with prostate cancer get it diagnosed at the metastatic moment when it's already metastatic. So it's not unusual that people can say, no, I don't want the test, or their doctor doesn't recommend it, or they don't get the test for one reason or another.
Grasping at every option here, is it possible he had the test, and can this test miss it?
Given the fact that the answer is of course, but given the fact that he has an annual exam, the test is unlikely to miss it. Given the fact that it's a Gleason 9, which means it's pretty wild looking in the sense of underneath it doesn't look like a normal prostate cancer. A prostate cell looks like a prostate cancer cell, which looks more atypical. It's not likely that his prostate-specific antigen, his PSA, which is the test we're talking about, would have been in the normal range. It would have been elevated above 4, and that does say you should do something about it. Now, you might test it again a few months later and see if the number has gone up or gone down, that you got an aberrant reading for one reason or another. But that doesn't seem likely in this situation. Either they didn't test for it, or they test for it, they didn't report it, and we didn't get the information as a public.